My name's Catherine Lee. I'm a professor in the School of Psychology at the University of Ottawa. I'm delighted to be talking to you with Dana Sheshko, a doctoral student in clinical psychology, about a systematic review we're conducting on child adjustment and parenting in families of refugees and immigrants. We'd like to tell you about why we're doing the review, how we're going about it, what we've found so far, the lessons we've learned, and where we go from here. We live in a world of great mobility. 1 in 5 people in Canada and 1 in 4 in Australia were born in another country. People move to other countries to build a new life for many reasons. Some seek new experiences, others move due to economic pressure, but sadly, the news is filled with stories of families who flee their homes due to conflict, war, and persecution. The UN High Commission for Refugees estimates that there are 11 million refugees, and the number keeps growing. Canada and Australia rank among the top 3 resettlement countries in the world. We urgently need to support newcomer families as they adapt to life in a new country. To provide evidence-based supports, we need to build on research about the risks and challenges these families face and the strengths and resources that protect them. In discussions with service providers in Canada, we've learned that the definition of who's a refugee can be contentious. Many people have told us that there's a fine line between immigrants and refugees, and many refugees may feel an added stigma when they're distinguished from other immigrants. So our review focuses on both refugees and immigrants. We're interested in what's known about children and their levels of emotional and behavioral problems, about the parents' adjustment, whether they're dealing with depression, anxiety, or PTSD. We're also interested in how they parent their children. We hope that a better understanding will help us design support programs to meet families' needs. Our project is a collaboration between teams in Canada with Dana and I, as well as Kim Schoen, and an Australian team with Dr. Divna Haslam, Anya Philus, Alina Moravska, and Agnes Sumargi. The teams share a deep concern to offer support in a respectful manner that will promote families' adjustment. We've been meeting regularly by Skype at the end of the Canadian workday and the beginning of the Australian workday over recent months to collaborate in the review. We share materials via Dropbox and email one another when questions arise. We've worked to define search terms, to set the parameters of the review, and to independently code articles identified in database searches.
In selecting our databases, we consulted recent empirical reviews, colleagues, and library research staff to select and employ a variety of search engines that are used in similar areas of research. After determining our search terms, we conducted searches in each of these databases using the following limits. We wanted to examine any available literature in any journal published in English over the last 20 years. Across each of the databases, we conducted searches across 3 separate levels, using any variant of each search term. The first level targeted the migration experience we are exploring. The search terms consisted of immigrant, refugee, displaced person, and asylum seeker. So any article that included these terms across the title, abstract, or keywords was caught in our search. The second search level incorporated the family component. We searched all variants of child, youth, adolescent, parent, and family. Finally, our third search level focused upon the adjustment of these families. In this, we wanted to consider both mental health and well-being, and also aspects of the parent-child relationship. Our search terms included parent-child relations, parenting, well-being, mental health, and parental psychopathology. In addition, we included the general terms of adjustment and adaptation, along with their variations. These 3 search levels were then combined to identify articles that included a term from each the newcomer, the family, and the adjustment level for our examination. So what did we find from these multiple research searches? A lot of articles. Over 1,300 articles were initially identified. Our first step was to check for overlap and take out articles which had shown up more than once. This brought us down to over 1,200. For our next step, we reviewed the abstracts of all 1,200 plus articles and removed the ones that did not meet our search criteria. We eliminated over 800 articles this way. For example, we excluded articles about international adoption and migrant workers who were separated from their children. This left us with 434 articles. Each team then independently rated the full text of these articles to determine their eligibility for our review. This resulted in nearly half of the articles being excluded. Some were excluded because the studies focused on individuals who were second-generation immigrants, so could no longer be considered newcomers. Others were descriptive articles that did not present original qualitative or quantitative data. In addition, we still have some question marks. We'll be contacting the authors of nearly 50 articles to ask for more detailed information to assist us in confirming whether these articles meet our inclusion criteria. An additional 30 or so articles were identified as providing useful background information. This leaves us with just over 150 articles for our review. In broad terms, these articles show us the following information. The vast majority of these are quantitative, with only a small number of qualitative studies. The majority of these focus upon immigrant families, and far fewer upon refugee, asylum-seeking, or displaced families. We'll be able to see whether the same patterns apply in immigrant and refugee families. The studies describe the experiences of families from a wide range of countries, including those in South America, the former Soviet Union, countries in the Middle East, various African countries, and many Asian countries. And these families are adjusting to life in diverse host countries in North America, Australia, Europe, and Israel.
So after all this searching, what have we learned? As you can see, only 1 in 10 of the articles located in the searches will be included in the review. Some well-known databases yielded an impressive number of hits, the majority of which were false positives. In deciding whether or not an article met the criteria, it's really important to stay close to the decision rules that we've established. Otherwise, it's easy to drift off track. The benefits of a team with multiple sets of eyes and many brains can't be overestimated. Our job was made much more difficult by the vague descriptions found in many articles. We're looking forward to the next step of finalizing our calculations of inter-rater reliability to see if the Canadian and Australian teams are coding the same way. So far, it looks promising. After that, we'll finalize our manuals for the real work of the review, extracting information so we can conduct a meta-analysis of the quantitative studies and a synthesis of the qualitative studies. We're eager to examine patterns to see if they're constant across children of different ages and if they apply equally in different countries. We look forward to being able to report the findings in the coming months so that programs can be informed by a sound understanding of newcomer families' experiences. Thank you for your interest. If you have any questions or comments, please don't hesitate to contact either of us.